name is Barbara Kay, and on behalf of my co-host Susan Pertnoy and the Jewish Federation of Palm Beach County, I'd like to welcome you to our program, Mosaic.
Our focus today is the Center of Excellence for the Care of Our Seniors, MorseLife. We'll be back with our program and our guests after this brief message.
They say that caring for the elderly is a profession of the heart. As the director of home health care at MorseLife, I know that to be true. When I see an older person feeling safe and secure at home, I know I've done my job. To make a difference, to show compassion, dignity, and respect, it's not just our job, it's our mission.
MorseLife Home Health Care.
MorseLife Health System, honoring senior living.
When I was young, I went to Jewish summer camp, traveled to Israel, and participated in leadership development groups. Today I'm teaching my children that being part of the Jewish community helps keep our heritage and traditions alive and vibrant, and can be fulfilling, exciting, and fun.
At the age of 90, I started a second career, delivering meals to homebound seniors. Because I'm a senior myself, I know how tough it can get. If somebody is in trouble and needs help, we need to be there for them. As Jews, it's who we are. It's what we do.
When my family needed help, we turned to the Federation, and they were there for us. How good it was for us to know that we are not alone.
Community, like every gift, counts. Together, we can ensure a vibrant Jewish future. Federation and you, changing the world together.
Right now, the Kaufman-Backler Challenge Grant is matching dollar for dollar new and increased contributions to Jewish Federation of Palm Beach County's 2016 annual campaign. Visit jewishpalmbeach.org/contribute to make your contribution now.
Keith Myers, President and CEO of this most remarkable MorseLife building and situation and whatever you want to call it. You are covering the community. This is amazing. Tell me, what gave you the impetus, in a sense, to develop something for, let's say, the next decade?
Well, 6 years ago, we became aware of a demographic study that was performed for the entire state of Florida. When you focus on Palm Beach County, one of the most amazing statistics is that the senior population in Palm Beach County in the next 10 to 15 years is going to triple. And
triple? Wow.
And because of that influx, some of the trends that are associated with it is that the need for short-term rehab and the need for independent living is going to double. The demand for assisted living is going to triple, and the demand for home and community-based services is going to increase by 800%. Because of those startling facts, the board of directors and the management team got together and decided that they had to reposition this campus for the future. So what we did was a 4-phase transformation capital project. And of course, we're sitting in the first phase right here, which is the Sandra and David Mack Short-Term Rehabilitation Facility.
That's where we're sitting right now.
Exactly.
Yeah, but you know something? The whole country is having a problem with aging. They don't know what to do with the aging population or how to deal with it. You have developed a concept here that is quite unique. I mean, it's just the beginning, really, of where I think you're going to be going. But how do you develop your ideas? I mean, where do you get the concept to build, let's say, the David Mack Pavilion, or the new one that's coming up with the Petra and the Levin?
Independent living?
Yeah. Where do you come up with those ideas?
Well, you know, we have to really be on top of demographics. We have to know what the market share is, and we have to be prepared to be able to meet this type of influx. So with all this information, we have to manage it, and we have to strategically plan for the future. So with all the facts that keeps coming to my desk and working with our board of directors, we finally figure out what we can do, how or if we can afford it, and what is best for the community.
Yeah, what do you find is the biggest challenge, actually, literally here, to cover in terms of needs?
I think the biggest need right now is the development of memory care service lines. As we just opened in June a memory care pavilion, which you'll see today in the program. And we took the oldest building, which is 35 years old, and we reconfigured the space into a 52-unit assisted living for memory-impaired residents and added 30 new nursing home beds for dementia care. But at the same time, the entire community is going to age, and the need for more, such as advanced dementia care, is going to be very important for this community. So that is definitely a challenge, but it's something that I am focusing on, because as you can see throughout this campus, we have an entire continuum of care. We are lacking the ability to provide advanced dementia care, but that is in our strategic plan.
You know something, that's got to be horrendous. I mean, the caregivers themselves need assistance. That's a very, very difficult period to go through, and I don't know where you find the opportunity to help that or change that.
Well,
I mean, how do you?
We do a lot of training.
You do?
We do a lot of training throughout the entire campus. We have one department that has grown from 2 people to 12 people that deal just with education. And we really focus, I have to tell you that I believe in hiring the best in the entire country. And I have searched for really one of the best people who run dementia units, and you'll meet her today in the program. Her name is Stephanie Frazier, who is the executive director of the Tradition of the Palm Beaches, the Tower, and also our new memory care. And she came from St. Louis, and I really did a national search for her. So once you hire the best of the best, then you bring education so you can make sure that the frontline employees, the nurses aides, the clinicians, all understand the philosophy about caring for people with certain type of disabilities. And I have to tell you that when you go to the memory care unit today, you will see that it's designed beautifully to promote the importance of quality care for people who are suffering from Alzheimer's, but also what you will see is the philosophy that we have embraced in caring for people with dementia care, incorporating the importance of sensory stimulation. When you go to the memory care pavilion today, you'll walk right in there and you'll see an open-air kitchen. We have a dedicated chef that works there from 8 o'clock to 9 o'clock every day who cooks breakfast, lunch, and dinner. It's just like you're living in your own home. If you're visiting with a loved one, you can get a cup of coffee. If they're making a strudel, you can get a piece of strudel if it's not during one of the main meals. And it's just a nice way because that smell of cooking is throughout the entire unit. In addition, we have spent a lot of time and a lot of resources in developing a beautiful art program focusing on paint, focusing on clay, on beading.
In other words, the individuals do get encouraged to do this.
Yes.
Oh, that's wonderful.
And another importance that what we have found in the delivery of dementia care is the importance of music. Every patient who lives in our memory care unit has their own playlist on an iPod. And we download that, we talk to the family members, we find what they were very interested in as they grew up, as they matured. We download that music, and in their leisure, they'll listen to it. And at times, sometimes they may get agitated. We put their iPod on them, and they become very relaxed. And we believe also that we bring in lots of top performers to not only put on concerts in the nursing units, but we also use our lavish gardens that you'll see so the families and the patients enjoy the music together.
Wow, so the entire environment is changed to give them a warm and loving home, and they feel comfortable there.
They not only feel comfortable, but they really they have a great quality of life. We feel here at MorseLife that we are setting the gold standard in dementia care. We will be recognized as a national model in the delivery of Alzheimer's care around the country.
You know something that's amazing, but you have been, what should I say, evaluated, and you are supposed to be the top in your class, from what I understand, for what you're doing here, which is quite remarkable.
Yeah, we're very proud of it. We are one of the top senior care organizations in the entire country, and people look at MorseLife to see what we are doing. I just came from a national conference, and people came up to me and said, how are you initiating this product?
And how do you do it,
how are you implementing this service line? Have you thought about building this new type of building? And it just makes you, it gives me a great sense of pride. And it's because we have a great community behind us, a wonderful board of directors, and we have, I believe, one of the best staffs in the entire country.
Yeah, well, I tell you something, you did it. When you came here, this place was okay, but now it's terrific. Not only are you taking care of the seniors so tremendously on this campus, but you also are involved with the seniors that are in the entire county, aren't you?
Yeah, you're absolutely right, Barbara. We have adapted to the changes in the healthcare arena. And one of the programs that we have started here on this campus is called the PACE program, Program All-Inclusive Care for the Elderly. And what's really nice is that there are 13,000 people who live in Palm Beach County who meet nursing home eligibility but choose to stay home. So what they do is elected to become part of our PACE program. We pick them up 2 to 3 times a day. We transfer them right here to our campus. They're seen by the medical director, by our nurse practitioner. They go to therapy, physical therapy, occupational therapy, speech therapy. They then participate in our adult daycare program. They have meals, and then we are totally responsible for all aspects of their care. So if they have to be admitted to the hospital, we have contracts with hospitals. If they have certain physicians that have specialties that they need to see, we have contracts with them. We have become an insurance product, and what is so wonderful is that the program has grown so tremendously is that now we opened up a second program in conjunction with Temple Sinai in Delray, which is our second PACE site, and we will soon be looking for a third PACE site because we are the exclusive provider of PACE in Palm Beach County. No other provider can provide that service because how we developed our contract, we wanted to make sure that we were the only provider of the PACE program. And if you think about it, PACE is the type of models that the government is looking for because it promotes high-quality care at low cost.
Yeah, it also keeps them out of nursing homes.
Exactly.
Yeah, because that's a very big problem. You know, we're going to listen to 2 amazing, amazing programs that you have, and then we'll come back. Okay? It was wonderful. I love listening to you, really.
Thank you, Barbara.
We'll be back with the remainder of our program right after this brief message.